president of the International Federation of the Red Cross has labeled misinformation as another pandemic, one that could slow down the fight against coronavirus. Here to talk this and more, we're joined now by Dr. Emanuele Capobianco, Director of Health and Care for the International Federation of the Red Cross. Doctor, so the president of the Red Cross said misinformation needed to be combated. I'm wondering from you, how difficult do you think fake news, as we like to call it here in the U.S., is going to be making vaccine distribution?
Well, fake news have been problematic from the beginning of this pandemic, and now are becoming even more difficult when new vaccines are planned to get into many countries in the next weeks or months. And I think on one hand, we need to combat fake news by bringing forward the positive news, the right information, to keep people really on top of what is happening in a fairly rapidly evolving scene. And the other one is trying to also understand what is driving the fake news and try to listen to the concerns that are being raised and respond to those concerns so that we can hopefully address many of them and bring those people that are on the other side of the fence on what is probably the right side of the fence.
So, Doctor, speaking about some of those concerns, the UK has already approved a vaccine from Pfizer, which has been met with, some criticism and pushback, at least here in the United States, from Dr. Fauci. Let's take a listen to what he had to say.
If you go quickly and you do it superficially, people are not going to want to get vaccinated. We have the gold standard of a regulatory approach with the FDA. The UK did not do it as carefully. They got a couple of days ahead. I don't think that makes much difference. We'll be there very soon.
So some pointed words there from Dr. Fauci that the UK went a little bit too fast when it came to approving this vaccine. I'm wondering if you think that the United Kingdom went a little bit too fast, and if you have any concerns about this vaccine and about rolling it out to hundreds of millions of people.
So let me just start by saying that having a vaccines potentially available within a year from the discovery of a new virus is something extraordinary. Having a vaccine that potentially has an efficacy, as has been reported, above 90% or 95% is another very good thing. Now, what we need at this moment is to have regulatory authorities all around the world certifying these vaccines independently in terms of safety and efficacy. And that is what is happening in the United States with the Food and Drug Administration process, what is happening all around Europe through the European Medical Agency, that it will be reviewing extremely carefully these files, and only after careful review, the vaccines will be allowed to go out and be provided to people that need it. And so we need to trust these independent systems that have been there, established, and have been reviewing plenty of drugs and vaccines that have come to us. And once we have that clarity, then we'll have to confront the new challenge of bringing the vaccines to the people who need them. And that is going to be quite a massive feat that will take a lot of efforts throughout 2021 and possibly beyond that.
I'm really glad that you mentioned those challenges, because the Red Cross, by its nature of responding to international crises rapidly, deals with huge logistical challenges all the time. I'm wondering what you see it is needed for a country like the United States to roll out a vaccine to hundreds of millions of people. And I'm wondering if the Red Cross is going to be involved in the distribution of vaccines either here in the United States or in other countries around the world.
Well, thank you for the question. First, the first obstacle is ensuring that we have enough doses for the people who need them. And, for some countries that have been procured in advance, the vaccines, doses will be coming in the next few months. There are a lot of countries, particularly poor ones where the Red Cross operates, that have not been so lucky and that really risk to remain behind. And we are very concerned about that. There are some international mechanism like the COVAX facility that can actually support the procurement and distribution of vaccines in poor countries, and we hope to have that more financed in the next few months. Now, the second problem is then once you have the vaccines to really distribute them through the population. That's going to be a massive logistical effort, particularly for vaccines that require cold chain facilities that can preserve the vaccines at minus 80 degrees. It has been done. We have done it in Congo with Ebola, but it is a difficult task, particularly because we are not talking about a few hundreds, thousands of people to be vaccinated. We are talking about millions, billions of people to be vaccinated. And the Red Cross will be there providing support in many countries. We are doing a lot of advocacy. We're going to do a lot of social mobilization of people in countries to fight exactly that vaccine hesitancy that we talked about later, and then we will be there to support the vaccination efforts. And right now, our national societies in 192 countries are actually, in talks with authority to see how our 40 million volunteers can help in the best possible way the national efforts that will be run and led by governments in the different countries.
So looking here at the United States, Doctor, obviously we have a federal government, but we also have states and local governments. This provides its own challenges, right? When it comes to an effort as large as vaccinating hundreds of millions of people, 330 million people here in the United States, just based on your expertise of, rolling out, vaccines across a country, do you think that an effort like this really needs to be something that is handled on a national level instead of, handed out to states to tackle on their own?
It's difficult for me to respond to a question specific to the United States, but I would say that in general, what you want is national plans that then are adapted to the regional or provincial levels in order to get all the steps lined up and prepared very carefully. What is needed at this moment is preparedness plans that are actually written and developed at all levels so that when the vaccines come, things can proceed smoothly. And we know that all vaccine will not be coming at the same time, so there will be a progressive increase that will hopefully give us time to get ready right. in the US as in other countries. So we're not going to have 280 million vaccines tomorrow, unfortunately. They will be coming slowly, and that's why the authorities are now prioritizing who should get them first, starting with the healthcare workers, frontline workers, and then the people, the oldest people in home cares.
Right. Well, some good logistical insight there. Dr. Emanuele Capobianco, Director of Health and Care for the International Federation of the Red Cross. Thanks for joining us today.
Thank you very much.